Hello and welcome everyone to our webinar presentation today, Dollars and Cents, the Cost Savings of International Direct Hire. My name is Ron Hoppe. I have the privilege of serving as CEO of Worldwide Health Staff Solutions, and it's our privilege to connect with you today in this presentation to share with you what hopefully you will find to be some useful, thought-provoking information that will assist you in your day-to-day planning activities around your recruitment strategies over the short, medium, and long term. We certainly want to hear from all attendees today in the form of any questions that you may have. And I would just ask that you please send us your questions using the chat box or the chat section of the home screen. I have one of our colleagues, CJ, who's monitoring our chat, and he will guide us through our Q&A period once we get through our presentation today. With that being said, let's dive right in to the topic today of the potential cost savings of international direct hire recruiting. I think to have this conversation, it's important that we have a big picture, the big picture in mind, or what I call a big picture reality check. These are things that I'm pretty sure that every talent acquisition leader, nursing leader, HR leader are generally very familiar with. But what I'm going to attempt to do is, just as we get to some actual cost-saving illustrations, is to ensure that we're thinking about all of the factors that impact our staffing strategies and our staffing decisions financially. So first of all, I think everybody agrees that efficient staffing requires some level of non-core staff. Seasonal fluctuations, flu seasons, vacations, etc. Just want to be very clear that in our discussion today, in no way are we advocating for the complete 100% elimination of contract labor. That would, in most circumstances, not be a sufficient, or an efficient response either. Also, as we look at the big picture in evaluating next steps in our staffing strategies, what we're seeing from very close tracking of the domestic contingent labor market, which we follow very, very closely, I think it's fair to say that domestic contingent labor costs have bottomed, and we're seeing in recent weeks that they're starting to tick up again. So that, I think, has to be a part of our evaluation and thinking as well. And then what we're seeing is some organizations are experiencing what I would describe as temporary staff whiplash. And by that term, what I mean is that late pandemic and post-pandemic, some employers had a super strong focus on eliminating agency staff. And they did that by implementing a wide variety of programs internally, internal travel pools, various off-shift incentives, weekend programs, extended tuition support programs, etc., to the point where some employers now find themselves having implemented programs that are in fact costing as much or even more than the current market rates for temporary labor. So I think that is something to bear in mind as well, to contemplate and to ensure that there's a clear understanding of what the costs are related to any internal programs that may have been developed, as I referenced, whether it's internal resource pools, internal travel pools, various incentive payments, etc., those programs cost real money, and it's important to have a good understanding of exactly where and how that fits into an overall strategy and at what cost. So I think that's at the highest level what I would call a big picture reality check. If we can go to the next slide, please. I think getting a little bit more granular, looking at the market today, I think there's a couple of significant factors that also have to be contemplated as part of the staffing strategy process. And that is a couple things that I've noted here. One is the number of new grads is increasing and the number of tenured RNs is decreasing. This is probably not new information to most employers, but this is becoming an increasingly significant phenomenon to the point where it's been given its own title. It's referred to as the experience complexity gap. So as the number of new grads increases, the nursing workforce is becoming increasingly novice overall. At the same time that the acuity of patients and the complexity of patient care continues to go up. Employers are responding in many innovative ways. Extended residency programs, et cetera, would be just one example. But those programs also have a cost in terms of time, non-productive payroll, et cetera. So the focus on new grads is obviously important, but I think it's also widely recognized that there is a limit on the number of new grads that can be deployed at any one time in proportion to the number of experienced nurses. Secondly, a very interesting development in the last couple of years, when we look specifically at the number of nurse graduates domestically here in the US, as measured by the number of new NCLEX exam passers. So nursing students graduate from college or university and then go on to writing the licensure exam, which is referred to as the NCLEX exam. Very interesting that in 2024, the number of domestic RN NCLEX passers was actually down slightly from 2023 after quite a few years of that number going up year over year and sometimes significantly. To now see a reversal of that trend is something that I think bears very close monitoring, and I think is also perhaps an early indicator of what's happening across the country in terms of college and university enrollments overall, which have started to decline. So while one of the responses to the shortage is we need to educate more people in the US domestically for these various health occupations, in particular nursing, the reality is a couple things. One, we've been having this conversation in the country for the last 20 years. We are essentially graduating as many as we ever have. In recent years, it's been higher than ever before. In 2024, we're seeing a bit of a correction. So there is, I think, reason to have real questions around to what extent can we rely on the education system to help close the gap on the shortages that currently exist and the projected shortages in the future. So I think that's part of our current market reality. And then lastly, again, as TA and HR and nursing leaders, you'll be very well acquainted with the issues of workplace stress, workplace violence, and burnout. We're seeing increasingly in various states legislation being brought forward in an effort to address workplace violence, particularly in the healthcare setting. There's many reports and a lot of data that's available that talks about the levels of stress, the fact that 40% of the entire nursing workforce is contemplating leaving the profession by 2027. These types of numbers are, quite frankly, alarming if they're even 50% accurate in their findings. So, big picture reality check. Um, Employers are increasingly confronted with this experience complexity gap. And we're seeing in the US domestically, there seems to be a limit on the number of new grads that we're capable of producing generally across the country, understanding that obviously the distribution of new grads is also going to be somewhat uneven across the country. Next slide, please. I think as we prepare to look at some of the potential cost savings or the actual cost savings related to direct hire international recruiting, again, just sort of level setting, making sure we all have the same perspective. Just to review, what are some of the main cost drivers related to staffing? Obviously, turnover. Again, numerous studies assigning, what is the cost of turnover of someone leaving and having to fill that position. Depending on what report you're looking at, you can get numbers anywhere from $40,000 to $60,000 and more as the cost to an employer when a position turns over. When we look at staffing cost drivers, we also have to contemplate non-core staffing of all types. So that would be contingent labor domestic, contingent labor international, and other internal programs that employers may have developed to try to address this. Other staffing cost drivers are incentive and bonus payments. So as I've referenced previously, weekend programs, increasing and very large differential payments for off hours, weekends, etc. And then something that's often not considered when we're talking about the cost of different staffing solutions is lost revenue when beds are closed. We're currently working with a medium-sized healthcare system, and they've come to us looking for a solution as to how they can reopen, 20 or 21 ICU beds that are currently closed due to a lack of staff. So when we think about staffing costs, there's obviously direct costs that are incurred, but there's also, I think, important that we consider the impacts of revenue that's lost by virtue of not being able to operate at full capacity or at an appropriate level of capacity. Next slide, please. So those are financial considerations. I think there's also very important non-financial considerations, because when we think about the potential cost savings of direct hire international recruiting, obviously cost savings are a financial metric, but I think one of the benefits of that particular strategy is it also brings significant non-financial gains. And I just want to, make sure that we're contemplating these fully as well. Direct hire international recruiting, in that it contributes to your number of core staff, right? The number of staff that are directly employed by you on your payroll, right? The first impact that's had is increased continuity of care. You have now new experienced nurse, for example, has joined your organization not on a 13-week contract, a 26-week contract, an 18-month contract. You have added someone to your team who, at the very beginning of the recruitment process, made a self-selection to be considered by your organization, has made a commitment, right, to work with your organization for a period of time. And the likelihood of them remaining on with your organization for an extended period of time, measured in many years, is significant. So continuity of care is one. Team dynamics between core staff and contingent staff or contract staff. Much has been written during the pandemic and after the pandemic about team dynamics and team interactions when you have a higher level of temporary or contract staff. There's also many things, studies that have been published, scholarly articles around the impact of optimum core level staffing and patient outcomes. That correlation is positive where an organization has optimum core staffing and minimizes temporary or contract staffing. And then overall staff morale and retention. It goes back again to my second point around team dynamics, where there is the opportunity for real friction or disconnection when you have contract labor as a significant part of your workforce. So as we get into some of the cost illustrations, please let's bear in mind these non-financial considerations as well. Next slide, please. So as we prepare to actually look at some actual illustrations of a variety of models, I want to just kind of level set with some cost assumptions that we're going to use. And what I know for certain is that these numbers are probably incorrect in your context, but we can't address every possible scenario. But I think this illustration will make the point, and you can certainly insert your own numbers as we go along to sort of see maybe in a more concrete way what the results would be for you. So the cost assumptions we're going to work with are that the average fully loaded RN salary for a year is $100,000. So that would be the hourly rate of pay plus adding on the costs related to benefits and mandatory payroll taxes, etc. So average fully loaded RN salary, $100,000 a year, right? Or about $50 an hour. That's if you're able in your market to attract a nurse, that's what this relates to. Someone that you're employing directly for the course of a full year. Then secondly, if you are using your existing staff to fill shifts and paying them overtime, we're assuming that overtime is paid at a rate at the base rate plus 50%. That's our assumption in these illustrations. And then we're also assuming that currently domestic and international contract labor is coming in at $90 an hour. Okay, so those are the assumptions that we're working with. Maybe the numbers are slightly different in your market. Again, we're walking through some illustrations here, and you are welcome to sort of plug in your own numbers to see exactly what the implications may be for yourself. So with that being said, let's go ahead and we're going to look at some actual illustrations here. If we could go to the next slide, please. So the first set of assumptions we're going to look at is in green. If you have, and all of this is based on one full-time RN FTE. Okay, so we're talking about a full-time RN FTE. Obviously, the most cost-effective way of filling that position, assuming it's possible for you to do so, is for you to hire this person directly without the support of any third-party organization or agency. And you are able to fill that position using core staff without having to pay any overtime. So based on our assumptions, if you're able to do that, your cost is $100,000 a year. And obviously that is your most cost-effective option. If you then look, if we look at sort of what the next progression may be, it would be if you fill a position 50% with core staff and 50% with your own staff paying overtime. So here you have a mix of core and overtime. So assuming a 50-50 split, that solution is going to cost you $125,000 a year. So 25% more than if you were doing this with all core staff. And then thirdly, if you are filling one full-time RN FTE with 100% with staff being paid overtime, your cost to do that over the course of a year is $150,000. So in this set of illustrations, I don't think it's really news to anyone that hiring core staff directly on your own is the most cost-effective option. Now, again, as we look at these various cost assumptions and cost illustrations, again, I would just remind us, of the non-financial considerations that we touched on earlier, including burnout considerations. You can only lean on your existing staff to work overtime hours for a certain period of time before you start having some of these non-financial issues, negative issues come to bear. All right, next slide, please. We'll look at another set of illustrations. So if we look at contract staffing versus vacancy, all right? So if you have a full-time vacancy, one FTE that you're filling 100% with contract staff, whether it's domestic or whether it's international, on a contract basis, that position is going to cost you $180,000 a year. Okay. Remember, we talked about hiring this for this position directly at costing $100,000 a year. So filling this on a contract basis, either domestically or internationally, is costing your organization 80% more. If we kind of moderate that solution a bit and say that you're filling this FTE with 50% contract labor and 50% your core staff working overtime, in that scenario, you can reduce your costs down to $165,000. And then really, if we go down to the scenario where beds are closed because of a shortage of staff, right? The cost implication of that is I haven't quantified it here, but it's very, very significant. And if beds are closed for any period of time, the implications go beyond just revenue generation. Perhaps we can do a whole separate webinar just on the implications of closed beds due to shortage of staffing. But the cascading impact of that, generates or causes an organization to incur costs that are probably much greater than the premiums that we're showing here for these staffing illustrations. All right. So then, having contemplated these scenarios, let's move on to direct hire international recruiting and just learn a little bit more about what the cost factors are in that model. So next slide, please. So a reasonable question is to say, okay, those illustrations are great. They're interesting or kind of interesting. But if I want to incorporate direct hire international recruiting, what sort of costs am I looking at there? And just to be fully transparent, I'm going to just quickly walk us through what the main cost components are of an international recruitment strategy or program. The first is you're going to incur immigration attorney and visa application fees. That's a cost that's incurred in this process. You will be invariably working with a recruitment agency who will be helping you to source, screen candidates, probably facilitate interviews in some way. Our clients, we also support throughout the hiring process in terms of extending offers, getting acceptances back, etc. There's also costs related to the international candidate credentials evaluation and other related licensure fees. And then to be competitive in the international space, employers are going to incur costs around items such as airfare to the US, temporary housing on arrival, and other. This is not an exhaustive list by any means, but it is sort of the four main cost categories that are going to impact the cost of your direct hire international strategy. So knowing that, then the question is, okay, I'm really, really busy. Our talent acquisition or our HR team doesn't have time to separately manage all of these processes. So what are our options? We go to the next slide, please. So generally, when employers look at an international recruitment program, particularly a direct hire international recruitment program, I think a key decision that needs to be made is, do you want to approach this sort of from an a la carte type of approach where you, as the employer, are managing each of these separate segments of the process, or would a turnkey solution better meet your needs? In the a la carte model, you as the employer would contract with different vendors for legal, recruitment, relocation, etc. You'd have to negotiate pricing for these various services, and you'd be looking for pricing that is fixed, that's not variable. So in the turnkey model, it's possible to receive proposals and quotations where you would have one organization manage all aspects of the process for you for a fixed all-in price for all of the services that go into the successful identification, hiring, relocation, and employment of an international candidate. Depending on the direct hire organization that you are working with, you can budget that your all-in costs should be somewhere in the range of $20,000 to $30,000. $20,000 would probably be very much at the low end. So just if you're receiving proposals that are in the high to mid 30s or higher, you're definitely being quoted well above market rates. But from a budgeting perspective, that's what you can expect to see. And again, you hear me using the term direct hire frequently as we go through this presentation. I do that because that is the only option from an international perspective where you can add these experienced international clinicians directly to your core staff. Next slide, please. So probably one of the most frequently asked questions that we receive when we're discussing direct hire international recruitment as part of an organization's strategy is, well, if we're going to make this investment, what can we expect in terms of retention rates? A lot of attention, and rightly so, is being focused on a wide variety of very innovative retention strategies related to the existing domestic workforce. And many employers are finding that those efforts are bearing fruit, that their retention rates are improving. But for most employers, they still aren't where they want them to be. Average turnover rates nationally are still stubbornly high. And turnover rates, particularly amongst new graduates or nurses in the first 2 or 3 years of their career, are at unacceptably high levels. So quite rightly, the question of retention is one that is brought up frequently, and it generally sounds something like, so what is your retention? What is your retention rate? Well, to be just absolutely honest and transparent, we don't have a retention rate per se. We play a very important role in retention, but we see retention as a shared responsibility between ourselves and our employer. There are clearly aspects of this process that we, as a recruitment agency, directly impact and can influence. And then there are parts of this relationship that we really have minimal control and no influence over, particularly once the applicant arrives and begins working at an employer site under their direction and control. So we see retention rates, quite frankly, varied between our employers. We'll get a little more granular here in just a moment. But clearly, retention is a shared responsibility between the recruiter and the employer. There's many things that we can do as your third-party partner in this relationship, in terms of very clearly communicating what your opportunity is and what it isn't, even before a candidate is even scheduled for an interview with you. We can ensure that the right expectations are set, so when the candidate arrives, what they find in reality lines up with what's been presented to them at the front end of the process. We can also work with our clients, and we do very closely, to ensure that best practices are shared and that employers have the resources that they need to best welcome, onboard, and support international candidates as they establish themselves in their new careers here in the US. What I can say with clear conviction is that our employers consistently report that their international direct hire retention rates are higher than they are for their domestic candidates. Two examples are hospital systems that report that they have, for their international candidates, 85% to 95% retention after 2 years. These are both organizations that have multiple locations, organizations that have a strong commitment to their international program, and are good partners in ensuring and sharing best practices for helping international nurses to be successful. These types of retention rates are absolutely attainable, and they're attainable in all parts of the country. These are not just retention rates with employers that are in, what you would think of being some of the more or most desirable geographies, right? One of these employers has facilities in Ohio and Virginia, and another has facilities in Iowa. Both of these probably not the first locations that international nurses think of when they think about working in the US, but it is possible to achieve these types of retention rates, and clearly to have retention rates of international candidates that are consistently higher than they are for domestic candidates. Again, thinking back to the financial and non-financial implications that we touched on earlier, I think this is very important data and very important feedback to consider. And then lastly, from a retention perspective, some of the international RNs that you will add to your core staff will be with you for the duration of their career or for an extended period of time. Having done this work now here at Worldwide Health Staff for almost 27 years, we have many, many examples of where international nurses have risen in the ranks to take on management, supervisory, preceptor, education, and other leadership roles, including a chief nurse officer in a number of organizations. So the opportunity to add individuals that, first of all, have self-selected at the very beginning of the process to be a member of your organization, and then secondly, have made your community a new home for them and their families, contributes very, very significantly to the financial and the non-financial benefits related to direct hire international recruiting. So let's look at some of the potential. Instead of just looking at this in terms of costs incurred, let's now look at this from a perspective of costs that can be saved. So next slide, please. Right. So here we have a series of scenarios, different scenarios, and here we're going to start at the bottom of the slide and work our way up. Again, these illustrations are based on one full-time FTE using our cost assumptions for nursing, the cost of hiring directly, the cost of agency staff. So if over 2 years you fill one full-time FTE RN position with agency staff, right? And there's many healthcare organizations that have 20 or 50 or 200 or more travelers or contract staff within their system at all times. So this is not a far-fetched illustration. This is actually very realistic based on where many employers are at. So if we look at the scenario of filling a full-time position that's currently filled by a traveler over 2 years, the cost of that is $360,000 versus the cost of $225,000 if you were to have filled that position with a direct hire international candidate. Then we have some other scenarios that we'll just quickly walk through here. If you have that same open FTE, it's filled 50% of the time with contract staff and 50% of the time with your own staff working overtime hours. You can see that cost differential is just over $100,000 or just over $50,000 a year. And then you can see further illustrations if you have one FTE that's filled 100% with core staff working overtime, or a scenario where you have open FTE that's filled, again, 50% by core staff and 50% by overtime, even if you're not engaging agency. But if you are relying on some degree of overtime, you're still going to save a meaningful amount of money. So when you look at the possibility or the potential cost savings, if you were to look at the number of contract labor or the number of positions filled with contract labor today, maybe it's 2, maybe it's 10, maybe it's 110, whatever that number is. Take a moment and just kind of on the back of an envelope even just scratch out what would happen if you were able to replace half of those travelers with an experienced international nurse. What would the cost implication be if you could replace 3/4 of your contract staff with experienced international staff? We can work out whatever scenario you want for yourself, but the bottom line is direct hire international recruitment brings you a wide array of non-financial benefits along with very meaningful direct financial benefits. The bottom line, if we can go to the next slide, please, is direct hire international recruiting provides you the opportunity to win 2 ways. Very, very important, maybe most important, is from a quality perspective. This strategy allows you to strongly support your commitment to continuity of care, to keeping up or increasing the overall experience level of your nursing workforce overall, while continuing to support and promote staff morale and retention. And then financially, we've just looked at a number of scenarios. and it is realistic that you can save up to $65,000 per RN vacancy filled per year using direct hire international versus contract labor. So a lot of information there. I'd be interested to hear if anyone agrees or disagrees either with the assumptions that have been presented today or has any feedback on the cost illustration. Certainly happy to engage in those conversations. Or if you have any other questions, I'd certainly be happy to respond to those as well. So with that, CJ, if you could join us and just help navigate us through our Q&A period.
All right, sure, Ron. Okay, thanks for that. Um, great presentation. So I have here like few questions. So let's start with the first one. Do we need to coordinate separate vendors for legal, credentialing, and relocation, or can you provide a turnkey solution with one point of contact?
Yeah. So I'll answer this a couple ways, just real quick. In the Worldwide Health Staff Solutions model, we offer our clients first and foremost the turnkey, all-inclusive package where we seamlessly manage all component parts of the process. And we do that for a flat fee that's known and established up front. So that supports accurate budgeting, etc. Employers certainly can undertake the effort where they're managing these various aspects on their own. But generally speaking, in my experience, that approach results in an overall higher cost. It also requires significantly more staff time from the employer side to help manage and navigate that process. And there's also the question of level of expertise. So having done this work now, as I mentioned before, for almost 27 years, there is a level of expertise that we bring to our clients, both strategically in how to set up and manage a program, as well as operationally. How do we find the best candidates, how to get them through the process as quickly as possible, and the things that need to be done to ensure that their transition and integration into their new home and new workforce goes as well as it can. So employers have choices, but we find in our experience, we're offering the turnkey approach really because we have found over the many years that this is strongly what most organizations prefer.
Thanks, Ron. Here's our next question. How do you support international nurses in adjusting to the US workplace culture and maintaining continuity of care?
Yeah. Yeah, also a very important question, one that we receive often. Again, I think we've done entire webinar presentations on this topic, and those presentations can all be found on the Worldwide Health Staff YouTube channel. But let me just comment briefly a couple of really important things that we do to help the nurse adjust. So, and that support really starts well before the nurse ever arrives into the United States. So, throughout the process, we are checking in with nurses, ensuring that their work experience remains current, that their resumes are updated, and we, at several points in the process, test their clinical knowledge and clinical skills to ensure that they're at a place where they're going to be able to successfully integrate. We have a pre-arrival education program that is customized based on the sponsoring employer and their priorities. So we share that program. We partner with Lippincott Learning in this regard, and we support our candidates in being able to complete a number of educational models that their employer thinks are most relevant to helping them get off to a strong start when they get here. We work closely with our employers to ensure that they have a thoughtful and robust plan from their organizational perspective to help welcome on board and support that candidate. As I shared before, that involves us sharing of best practices. That includes our relocation team working closely with the applicant and their family on the actual relocation logistics, arranging for housing, temporary housing, some cases permanent housing, supporting them enrolling children in school, employment for spouses, a wide variety of support services. And then our candidate success team stays with that candidate at least for the first 180 days that they are working to help support them with any questions that they may have, challenges related to assimilation, whether they're work related or whether they're social or whether they're family related. Our team is able to support, provide whatever additional resources may be required, or bring in resources that may be appropriate in a particular situation. So the number of or the scope of the support effort spans everything from clinical preparation, clinical support, social support, uh, ensuring candidates are properly prepared for their relocation. So it's really a very comprehensive, multi-pronged strategy that involves, from our side, several of our teams to ensure candidate success, that these very, very high retention numbers can be achieved.
All right. Oh, thanks, Ron. Our next question is, how do you ensure compliance with immigration laws and employment eligibility for these direct hire nurses?
Mhm. Well, first of all, compliance with immigration laws. So we've been doing this work, as I said, for many, many years. So we are well versed, obviously, in what the immigration laws and processes are. We have our own internal legal team that comprises of numerous immigration attorneys. These are attorneys that specialize specifically in healthcare immigration. And we also work with outside legal firms, some of the largest healthcare immigration law firms in the country. Our existing staff is closely connected to ongoing continuing education programs relative to immigration rules that may be updated, processes that may be changed from time to time. So I would say we ensure compliance through our experience, through a commitment to ongoing professional education and development of our staff, and to partnering with industry leading healthcare immigration attorneys to help and to do an important part of the overall work that we do. So I think from a compliance perspective, we're very, very strong. There's also compliance considerations from the applicant's side, right? So we also work with our candidates to ensure that they're fully informed of what their obligations are, the things that will be evaluated or tested in their application. So it's our compliance and knowledge of the rules and regulations, but it's also ensuring that we're informing and empowering our candidates, our applicants, to know what the compliance requirements are on them. So that would be that part of the question. What do we do to ensure employment eligibility for these direct hire nurses? So again, multi-phased process. There's a well-defined process of what a nurse has to do to be able to establish their eligibility for employment in the U.S. We partner very closely with True Merit, formerly CGFNS, some others, where nurses have to complete a formal third-party credentials evaluation. Our team, we have a licensure team that's extremely knowledgeable in all aspects of these types of evaluations, required English language tests, language scores, work experience requirements in specific states. Again, we simply have the resources to ensure that we're on top of the changes that take place, not infrequently, related to the requirements for international nurses to be eligible for employment and then to be eligible for licensure here in the United States.
Okay. So here's our last question, Ron. How does the performance of internationally hired nurses compare to local hires in terms of patient outcomes and adaptability to our systems?
Yeah. So this response obviously is going to be general in nature because whatever response I give, somebody's going to point to that one exceptional case where this wasn't true. But speaking in general terms, I think the performance of internationally educated nurses compares um, very favorably, certainly on par and favorably with the typical domestic hire in 2025. I think a key point of differentiation is that international nurses currently are arriving in the US with somewhere between 5 and 10 years of experience. That experience is invaluable, right? Where particularly where employers are dealing with very large numbers of new grads that need significant support for them to be able to be working independently. So there's certainly that. Anecdotally, one of the greatest sources of satisfaction that I have as the leader of our organization is when we do visit client sites and we have the opportunity of touring their hospitals and meeting the nurse managers in different departments, meeting international nurses that have been placed there, just how consistently these nurse managers that are on the front line working with the international nurses provide us with glowing reports, glowing feedback on the skills, the capability, and the contributions that international nurses are making. Now, international nurses come with experience, but they are also coming from different work environments and different cultural environments. So, look, there is a period of adjustment. There is a period of acculturation that is going to be somewhat different than just onboarding a domestic new hire or the typical domestic candidate. But again, following best practices, working collaboratively together, ourselves and the employer, those issues can always be satisfactorily addressed. So, the reality, CJ, is 16% of the nursing workforce today in the United States received their nursing education outside of the US, right? Just think about that, 15%. So that's just right around 1 out of 6 nurses, an astronomical amount. Our healthcare system would collapse absent internationally educated nurses, internationally educated physicians, and other clinician types. So I think it's been proven over many years, over decades actually, that the contribution of international nurses, of international physicians is very, very significant. It's very positive. And I think there's no reason to think that that isn't going to continue well into the future.
All right. Thanks, Ron. So that's it for our Q&A session. So if you have any final thoughts that you can share.
I would simply say, CJ, if to those that have questions in the chat that are more applicant focused, please feel free to share, to send those questions through to recruiting@healthstaff.org. That someone from our recruiting team will respond to you with regards to those questions that are primarily applicant oriented. Beyond that, CJ, I would simply say to those that have joined us today live, thank you. This presentation will be available starting tomorrow on our YouTube channel, Worldwide Health Staff Solutions on YouTube. So you can go back and refer to part or all of this presentation at your convenience. If you believe that the information discussed here today would be of interest or beneficial to one of your colleagues or peers, please feel free to share the YouTube link with them. If you do have any inquiries or have an interest in learning more about what a direct hire strategy may look like for your organization, we would welcome that inquiry and look forward to following up with you promptly. So thank you for joining us today.